horizontal fissure or oblique fissure.
Right lung 3 fissure, na? 3 fissure?
2 fissure.
2 fissure and 3 lobes. So can you see here from that side, that corner, a fissure is here and 1 fissure is here? So can I divide it into 3 parts?
Yes, ma'am. 3 lobes.
So when you will see the first, you should see the fissure and you should lobe you will have to see. And how to hold this narrow border, the thin border always will be front. The narrow border will be in front. So keep the narrow, it is the anterior border. Keep it in front direction. Narrow border, prominent border, this will be in the front. This is the posterior border. The broad is the posterior border. The sharp is the narrow border. That is the anterior border. Upper pole, this we call the upper pole. Can you see there is upper pole is not a point, it is an area. So first rib is just like this, so it is the upper pole. This is the base. So it is the apex or it is the base. So apex, base, anterior border, posterior border, and circumscribe the base, it is the inferior border. Anterior border, posterior border, inferior border, apex, base. This surface is known as the costal surface. You remember?
Yes, ma'am.
Costal surface, why? Because all the ribs impressions are here. Everybody see how nicely ribs are going there. So costal surface, this is the costal surface. All the ribs impression I can see here. This is the costal surface. This total surface is the medial surface. This total surface is the medial surface. Medial surface again divided into 2. Mediastinal and vertebral. Mediastinal and vertebral. Mediastinal and vertebra. Why the name is the vertebra? Vertebra is coming in relation. So this is the vertebral surface. So what I got? Apex, base, anterior border very narrow. You should keep it front. Posterior border ill-defined thick. Inferior border is there. And also the costal surface ribs impression. Medial surface is divided into 2. Mediastinal surface and the vertebral surface. Vertebral surface, there is a impression of body of the vertebra. You see body of the vertebra impression. And here in the mediastinal surface, hilum is there. Can you see the door of the, you see how nice the hilum? All the bronchial artery, broncha, amar boro bhai, bhai, amar broncha, all are related here. So these opening we call the hilum. Hilum of the lung. Hilum of the lung, short note is coming. So this is the right lung along with all the anatomical points. I can say this is the right lung. I can say the surface. I can say the border, etc. Pole, all the apex, base, everything. Now come to this. Now when you will hold it, no need to hold. Now you can take like this also, or you can hold it. But I will show you like this. This is your mediastinal. So I am taking permission and I am just removing the anatomical position and I am looking forward. So this is the hilum. So in the hilum, I will ask you what are the structures are there. You will tell from above downwards, before backwards, as I told you. And then other relation in the hilum, in the mediastinal surface. Above the hilum, right lung ki chilo ei notchta archa vajaga. So how you will give your index finger? Above hilum, you see how nicely arch like area. Archa vajaga. Got it, everybody? So how you will give your hand? Above the hilum, archa vajaga. Corner towards the anterior border, just towards the, there is a depression. Ami kori ni dekho. There is a depression, SVC. Group for SVC, got it?
Yes.
Archa vajaicus, SVC group. Parallel to that SVC group, below we get another very nicely, I can show you, that is, but not so much prominent just like SVC. If to come prominent, there is a prominent, less prominent, we can see that is the group for SVC. So archa vajaicus, SVC groove.
IVC.
Parallel to that, he will go towards the base and he will give hand here. IVC. In front of the IVC, near your anterior border. In front of the IVC, near your anterior border, cardiac impression. So this is your anterior border. So this area is some depression, cardiac impression. Remember that picture? Cardiac depression. Now the last. You told na, behind the hilum in the back side, along the posterior border, the long impression is the groove for esophagus. You see, I am giving my hand. Groove for esophagus. And the last, from apex to arch, trachea. Trachea, from apex to arch, groove for trachea. Again, revision. This is my hilum. Above hilum, arch of azygous vein. Corner in front of the hilum, IVC. In front of the IVC, near the anterior border, cardiac impression. It is not that he will show only. You will have to describe at the time of showing. In the back side of the hilum, near the posterior border, the long impression is the esophagus, groove for esophagus. And from the apex up to the arch, it is the trachea. So these are all the relations. So these will help you in the exam time. I feel that is the cartilage. So that means obviously it is bronchus. But the luminous structure I can also feel. That means they are the artery. Mainly the big lumen where I get artery. So pulmonary artery. So thus I can differentiate here. If I get, you can feel it. Anybody who want to give your hand, you can see in front of me. That Baba. Cartilage. You see this side also. Lumen. Lumen, you give hand in this lumen. No, soft. So there is arterial lumen. And get a heart, that may be the bronchus, cartilage. So thus I can differentiate what are the cartilage and where is the arterial lumen. So within the hilum, please prepare it. So this is about your right lung. Just behind the esophagus, you take your hand like this. Esophagus. Trachea to kana thoracic. Esophagus and ill-defined thoracic duct. So same place you can give your hand. So what you will do? Arch of aorta, continuous as descending thoracic aorta. Esophagus and ill-defined thoracic duct. In the back side, complete. Back of the hilum, complete. Now go other. You told this is the arch of aorta. So it has an artery. Dekho gorso korash. That is, you will have to give your hand left subclavian artery. Important impression. This is the arch of aorta. Here left side. So always show in the anterior border relation. Not in the back side left subclavian artery. Here left subclavian artery. Arch of aorta. Descending aorta. Esophagus.
Indefined
thoracic duct. Left subclavian artery. Now the left subclavian vein, you may or may not tell, just cite. Just cite it as well. But if you forget, no problem. It is a left subclavian artery, side left subclavian. So it is no measurement, you just keep your hand by sight as per the diagram. Now I told you pulmonary trunk is there.
Yes, ma'am.
Just in front, you see this area. Just in the hilum, in front of the hilum, near the anterior border, I have drawn also a very small impression in the copy. Pulmonary trunk. You see? Pulmonary trunk. Pulmonary trunk. Can you give how I am giving my, and this elevated part also. Pulmonary trunk. And the last, cardiac impression. How big you see. And have you seen how depressed area? It is not so much depressed in the right. But here you see what is the condition? So much depressed. It is so much depressed. Cardiac impression is very prominent in case of the left lung. Archichuna, complete. Same to same you tell. Only you describe the different impression. Here arch of aorta, here azygous vein. That you don't tell wrong. Don't do any just you are quickly you are in hurry and you are telling here is the arch of azygous vein. Arch of aorta. Then and then you should continue with this descending thoracic. Then and then you complete the back side. Esophagus and thoracic. Then you come front. Left subclavian artery. Then, and the anterior border is this. This is the posterior border. So many borders, so many surface. How to hold? Holding is very easy, na? You can keep there. No need to hold. You can keep like this. But you'll have to show this is the apex, tulenia base, anterior border very thin, posterior irrelevant border, inferior border like this. Got it?
Depression ta koto inferior border.
Inferior border পুরোটা দেখো কি সুন্দর, encircling the base. Total is the inferior border. So that is the lungs. You complete it.
Hola, ¿cómo estás? So nice to meet you. You said we should go and get a room. No, if you wanna turn